here, and then we start seeing the anterior frontal lobe. You don't even see brain here yet. You just see spinal fluid. Next slide. Next slide. You see the space here, space in between, and the space between here is more than space over here. And that's your orbital frontal cortex, part of your frontal lobe. Some atrophy, not a ton of atrophy, some atrophy. Okay, this is a color picture. This is our DTI. Let me get over here so you can see better.
Okay. You can move the microphone with you.
Thank you. So what we're looking at here is...
Let me interrupt you a second. You're using some initials here. What is DTI?
DTI is diffusion tensor imaging.
What's it designed to show?
Axonal interruption. Theoretically from traumatic brain injury. However, white matter lesions from like strokes can cause that to be abnormal as well. But I can tell you that he has no white matter lesions on his brain.
I interrupted you. What's depicted on this particular slide?
That the green indicating a flow of axons is greater on one side than the other. There's a paucity of it on this side. Next picture is even a little bit better. Here we got green and blue. Really got nothing over here other than a little yellow. So this tells us that we have some frontal lobe damage. I think that's it.
So, if we put all that information together, what kind of conclusions did you come to as regarding Mr. Wilson's brain, his brain injuries?
There are two basic conclusions. One, with the ventricular asymmetry. Ventricular asymmetry can be a normal finding, but in the setting of psychiatric disease, it indicates cognitive and emotional dysfunction.
Okay. How does that manifest itself in somebody's conduct?
It's going to cause worse behavior. It's going to cause less thinking. It's going to cause less likely to modify evidence of some brain injury. The atrophy of his superior anterior temporal lobes as well as his frontal lobes is an important combination. When you have atrophy of your amygdala, which is one of your main points of your limbic system, it creates for emotional instability. It makes you more likely to get mad and not be able to calm yourself down. The frontal lobe impairments cause one to be more likely to be impulsive and act without regard to consequence, act without plan, more likely to be irritated and agitated, and the frontal lobe is also important for stopping behavior arising out of your temporal lobe.
Is it practical to assume that these injuries to the brain occurred contemporaneous with the traffic accidents?
The location of this, at least the atrophy, is typical
Of the what? I'm sorry?
of the atrophy, the shrinkage,
Okay.
where it pulls away from the skull, is typical of trauma to the brain. That's where the skull is the hardest, and that's where it beats up on the brain the most.
So if Mr. Wilson has been in custody since the date of his arrest, which was 2 days after the incident, presumably he had this same brain injury back in 2019.
Yes, but atrophy takes time to develop. It didn't just occur in the last year. It's probably been occurring over the last several years.
Okay. Is there anything that can be done to repair or replace?
No, but medication can be helpful at modifying his behavior, mostly from psychiatric disease, because this isn't somebody with this injury on top of bipolar disorder, major depression, schizoaffective disorder, whatever it may be. It's going to make it worse. So if you at least treat the psychiatric disease and basically a simple answer is this can be treated.
Okay. So the problem that you have described as a result of the brain trauma is separate and distinct from the psychiatric diseases that he has?
Yes. Most psychiatric diseases don't have a MRI finding and say, hey, you have this disease. Schizophrenia, they're starting to see some findings of some commonalities between MRIs and PET findings, but nothing's been established as this is it.
Okay. So this is basically in addition to anything that a psychiatrist or the neuropsychologist may have testified to.
Yes.
May I have a moment?
You may.
Mr. Gardner, do you need this?
I do not, thank you. Good morning, doctor.
Good morning.
Now, you indicated you had an opportunity to sit down and meet with Mr. Wilson, and you conducted a series of tests. Is that right?
That's correct.
What internal validity measures were in these particular tests?
The MOCA does not have any internal validity measures. However, I find it difficult to believe that someone would fail two parts of it and do excellent on everything else, but the parts that he failed in were the things that the MRI supports that he would have impairments with.
Okay. Well, I'm asking you specifically about the screen nerves tests, the motor exam tests, the muscle tone, the sensation, which is your deep tendon reflexes, and your assessed Romberg tests.
What about those?
Are there any internal validity measures in those particular tests?
Well, reflexes, I like to see someone fake it because that's not something you can really do. I mean, I've been in this for over 20 years. I've seen people try, but you can't fake it. Motor examination, you can also see that too. There's actually built-in validity testers when you test for leg weakness, but he exhibited no weakness, so I had no reason to believe it was invalid. Tone, he doesn't know what I'm checking for. How's he going to fake it?
Well, my question to you is you conducted these as forensic exams, did you not?
I did.
And forensic exam means that it's an examination by a medical professional for the use in a criminal prosecution. Isn't that right, sir?
Yes.
Okay, and because of this is a forensic examination, you would agree with me that Mr. Wilson has an interest in the outcome of the evaluation, does he not?
He does.
Okay, so continuing on, you conducted these screen nerves, the motor exams, the muscle tone, the sensation, the assessed Romberg tests, sticking someone's tongue out, making sure that their face is symmetrical, making sure that he can smile, whether or not he can shrug his shoulders. Those are all things that you took into consideration, and that is based upon Mr. Wilson's cooperation with you, is it not?
Yeah, those other things were normal too.